Local stories, local people. We're taking you inside Western Mass news. It's the Even Better Western Mass podcast with Dave Madsen.
Welcome to this week's edition of the Even Better Western Mass podcast. Wherever you are, hope you're doing well as we head into the second week of March. Things looking much brighter here in Massachusetts and across the country. COVID-19 cases are down. More people are getting vaccinated. In Massachusetts, at least, more things are opening up as we head into spring. So I think overall things are looking very good. Well, my guest this week on the podcast is Ben Kraft. He's the Vice President of Community Engagement for the Center for Human Development. Community-based care is really the heart and soul of CHD's mission. It offers more than 80 programs and services that help people tackle life's toughest problems, even more important during this COVID-19 pandemic. Ben and I talk more about CHD's mission and the services it's provided to people in Western New England since the 1960s. Here's my conversation with Ben Kraft. Ben Kraft, thanks for being a guest on the Even Better Western Mass podcast. Good to see you.
Good to see you, Dave. Thanks for having me.
It's been a few years in your new role at the Center for Human Development. Let's talk about that, and let's talk about the Center for Human Development itself. I mean, a lot of people have heard of it, but I think there are many, many people out there who really don't know what it is and what you do.
Yeah, I think that's absolutely right, Dave. And it'll be 3 years for me this coming June. And I feel really lucky to be part of this organization that plays such an enormous role in supporting and helping people across Western Mass and even down into Connecticut on a number of challenges that take place in their lives. So CHD, the Center for Human Development, we have a workforce of almost 2,000 people now across Western Mass and down into Connecticut. And we provide a range of mental health support, recovery, social services for people across the region. We have more than 70 programs in Western Massachusetts and Connecticut. And again, the spectrum of those services goes from mental health counseling into children's therapeutic services, homelessness and shelter services for people who are running into issues with housing, what we would call early intervention services for children who are not perhaps meeting developmental milestones and need a little extra help there, as well as community residential programming for people with intellectual and developmental disabilities, as well as people who are in need of recovery support for addiction. So all in all, about 27,000 people a year benefit from CHD's services and support. And like I said, I'm very, very proud to be part of this organization, especially at a really hard time for our community.
Indeed, I mean, COVID-19 has presented challenges for all of us, and we'll talk about those. But let's talk about some of the services that you do offer. And I mean, we can take them one by one, or you just go along as you want to on this. But let's talk about mental health and counseling. I think one of those things that we don't think about until we need some help like that.
Yeah, I think that's absolutely true, and I think there's an increasing realization, as we think about healthcare and health and wellness, that mental health is sort of intertwined very deeply with our physical health. And as you look at the way mental health services that for a long time were significantly underfunded and sort of overlooked, and the way that state government funders and insurers have really embraced the notion that getting good mental health support is a very important part of people's overall wellness. I think that's been a very positive trend. And so we're seeing a reduction in the stigma about accessing mental health services, which is something that was always a challenge in the past. There have been a lot of really successful public efforts to encourage people to be more vocal about their mental health and advocate for themselves. And I'll tell you that mental health is something that is very much front of mind for us as we cope with the realities of the pandemic. And I think, as we're all used to this quote new normal, which in reality is, sort of a series of very chronic stress events. I mean, I think when you think about big stressful events that have happened in the public consciousness in recent years, something like, a September 11th or some of these terrible things that have happened, they were awful for all of us to deal with, but they were very compressed events that happened in the course of a single day. What's happened in the pandemic is it's been sort of this slow motion car crash that is now going on almost a year for all of us. Yeah. And whether you're an adult, a child, I mean, you're just dealing with this kind of on a daily basis, this grind. And so it's really important, to spend some time thinking about doing that check-in with yourself, with the people you love, with friends, to say, are you doing okay through all this? Because I think all of us are having these days when we're feeling like mentally we're really not okay.
I think in many folks' mind, there's a stigma attached when you talk about mental health. But the fact is, a very good friend of mine for many years said, "Listen, with everything that we have to deal with in our lives, the people who have the real problems are the ones who aren't smart enough to seek out that help." And as you mentioned, even more so, in the fact that I think it was as we looked at this when it started a year ago that, well, all right, we'll be by the summer, we'll be okay. Then it became by the fall, and then by the winter. Well, here we are a year, I think you're right. I think people are just exhausted, and that does take a toll on us.
And we never, I completely agree. We never would have anticipated the duration of this crisis when it began. I mean, there was so much uncertainty. And frankly, when I look back a year ago, as I was watching the news unfold in places like Europe and in Asia, and when it first sort of took hold in Seattle, and you were very quickly hearing stories of, hospitals becoming overwhelmed and running low on ventilators, it was really terrifying. And then, as eventually our nation sort of got itself together and started to respond, and I mean, I tip my cap to all the hospitals and health providers who have been remarkable throughout all this. But as it became more of a chronic crisis, it went from, oh my goodness, are we all going to die, to I don't know how many more weeks of this I can stand. To be a little more positive, I think what's starting to happen now with the vaccine rollout, with some positive news coming, is the light is appearing at the end of the tunnel, right? And this is starting to feel like something that it will at some point more or less recede into the past. And we're going to be able to, go to a ball game again or attend a concert again. And the kids are going to get back in school, which is incredibly, incredibly important. It looks like we're hoping to have some vaccine access for children by the end of the summer. And hopefully we'll see a real push to get those kids, and teachers in a safe place so that they can resume their normal lives. I know a lot of us are worried, and I know you have grandkids and family. We worry about the impact of this on kids' development and their social and emotional health. I have a 13-year-old and an 8-year-old, and they're doing okay. But you know what? I got to tell you, they want to see their friends, and they want to go to birthday parties, and they want to go to the beach this summer with their friends and do that sort of thing. And now I feel like we're starting to look ahead to phases where things start to become a little more normal again, which is an enormous help to all of our mental health.
Yeah, I do. I worry about my grandkids. Because I look at my generation, and I think the thing that we had, the baby boomers, was polio, and that big fear. But you didn't have social media feeding it. You didn't have all of these cable networks feeding it the way we have today, and you just wonder with kids, and I do. There's the short term impact, but also the long term impact that this. I don't know if you call it a fear or whatever else that really it worries me. It's like, helping children deal with this. It's like you almost, in many ways, just don't know what to say to them because we don't know.
Yeah, that's right. And it's interesting. We're all sort of cocooned as families, right? And loved ones together in our homes so much more than we were before. And that has kind of a good side and a bad side. And I think the healthy relationships in the home and the healthy dynamics, I see some benefit from time to time. Kids who have anxiety, social anxiety, kids who are having challenges with other kids at school, that increased time with mom and dad can be really incredibly helpful and makes them feel more secure and cared for. When, like I've been doing once in a while, dad's working at home with them and also spending time helping them with their schoolwork. Or mom's doing the same, or family members, grandparents. But I think the other thing about the cocoon is that when there are negative dynamics in the home, when there are stresses, marital stresses, financial concerns, I mean, Lord knows everybody's got many people have got so many financial concerns related to this, how it has affected their very livelihoods. The cocoon can also amplify those negative dynamics, whether it's parents who aren't getting along, whether it's substance issues, reliance on alcohol, narcotics, and then the kids are really smack dab in the middle of it, and it's all very compressed together. And so for all of us, I think being aware of our own emotional state and practicing that self-care, not only as family units, but also as individuals, getting out for that walk, and I have to tell you, I'm walking myself into the ground these days, and I feel like I'm eager to do something besides go out and take a walk once in a while, Dave. But finding those outlets, whether it's a hobby or reading or connecting online with friends in a safe way, those are the sort of things that help keep you going until you can reach the next stage where we feel like again we can start to do that stuff again.
Yeah, you touched on that. The fact that with stable families and that dynamic that yes, it's putting a stress on them, but when you look at families that may not have that stability, single parent families or whatever else, and maybe someone's lost a job, just those added stresses, stuff that we can't even conceive, I think, in many different ways.
Yeah, and I think at CHD we're certainly seeing that in terms of demands for counseling services. We have a lot of inbound need right now, which is not a surprising thing to me that the pandemic has increased those stresses in families. And we are well equipped to meet that need. We have transitioned a lot of our services to a remote basis so that where formerly you might have had a counseling appointment in person, now you can do it via telehealth, via voice, via video call or telephone call. We have a new telehealth program called Where You Are that people can access on our website if they want to explore that. And then the more dire things, the things you worry more about, and I appreciate you raising the issue of families that are in significant crisis, is people experiencing homelessness, people in need of shelter. Fortunately, some of the government action to hold up on things like evictions and foreclosures has helped a little bit, but it feels like that big wave is coming. It's out in the ocean right now, and eventually it is going to hit, and we're going to unfortunately see a much higher number of people who are in need of housing supports, which is something that CHD does, and I think we do a pretty good job of keeping people out of those emergency shelters and getting them into stable housing. That's something our society and our communities are going to be dealing with for quite a long time now. And so, the more resources we can bring to help with that, I think the better for all of us.
Let's go back to a year ago when all of this hit. I mean, around this time we were hearing about COVID, but I don't think we were really feeling the impact of it. Then we got to the end of March, and by St. Patrick's Day, well, let's put it this way: it hit the fan. And now I've talked to other folks from other agencies like yours that you really had to shift gears very, very quickly and basically change the way you do business.
Yeah, that's right, Dave. I think that probably about the 1st of February is when we saw that this thing wasn't going to magically stop at the border. We really began to look hard at the spectrum of services we provide. And that goes from not only mental health and counseling, but we have a very large number of residential programs here across Western Mass and in Connecticut for, children who have run into some criminal justice issues, to people who are working on their own sobriety and their recovery, to people with intellectual developmental disabilities, people with significant mental health challenges. Like so many quote first responder type services, those things don't go away when the pandemic hits. You can't close down the house for people who are working on their recovery. So we really pivoted pretty quickly and sort of started asking ourselves questions. What do we need to do first and foremost to keep the people we serve safe, to keep our staff safe, and what services can we transition so that people still have access to support but can do it in a safe way? They don't have to be commingling with each other in person. And obviously a big first part of that was personal protective equipment and accessing the gear that our workforce needed to continue to provide those in-person services, which many of us have read some of the interesting stories that kind of sound like something out of a John le Carre novel of the lengths that people had to take to find PPE for their staff. And so we certainly were in the thick of that as well. And all of a sudden I became sort of a part-time logistics person, getting on conference calls with military people, former military people, trying to access gowns, gloves, goggles, hand sanitizer, which in the early days was a really scary thing because it wasn't flowing. It didn't feel like there was a centralized plan. It was a little bit mercenary in that organizations, states, and hospitals were almost competing with each other. We really benefited a lot at CHD. We've gotten a significant amount of support from the Community Foundation of Western Mass. I really want to make sure I give a shout out to Katie Zobel and her team over there. They have been remarkable. The governor's COVID-19 relief fund has also been a significant positive force. We really appreciate that because, it was a significant outlay for us in terms of making sure our people were safe. and I'm happy to say, we haven't had a lot of sickness in our programs. We've done pretty well through this, and the PPE is a big part of it. But it was just one example of, looking at services that can't close down because of a pandemic, and how do you keep those going and keep those going safely.
Yeah, a big part of that with you too is the fact that your services are needed now more than ever before, just by the pressures of what we're dealing with.
Yeah, I mean, I think that's true, and I think that will continue to play out. We do have access to people for people who needing services. I mean, they can certainly call our 1-844 CHD help or visit our website. I like to think we're doing a good job of getting people in relatively quickly to access services, whether it's adults, children, different needs. We also have a number of outreach programs that can either provide services remotely or actually come into your home safely in protective gear and provide, for example, children's counseling services in the home through the Children's Behavioral Health Initiative. So there are a lot of options, and I think my great hope is that we can continue to meet the need even as it grows, because I don't think we're out of the woods yet in terms of the need.
Yeah. You're seeing a lot of people who, along the line, never thought that they would ever need to go to a resource like the Center for Human Development, but found that because of what's going on, they do have that need. So I'm guessing that your clientele has grown substantially.
Yeah, and I think it's interesting in that, we talked at the top a little bit about, whether people understand what CHD does and what CHD is. And I think one of the historical things about agencies like ours and social service agencies is, they've kind of been regarded as an option of last resort when people really are in very difficult circumstances. I think the reality, when I look across the spectrum of really, really talented counselors and psychiatrists and therapists we have here at CHD, our amazing force of social workers, these are options that are available to everybody in every community in Western Mass. And I would really encourage people to, visit our website, learn a little more about us, and, consider us as an option, because I'm amazed when I get the chance to interact with our professionals, really how incredibly capable they are and how resilient they've been through this. And, that's top to bottom, that's across our organization. Our staff have been really brave, really remarkable, and really, shown their heart and commitment throughout this whole crisis.
Are things getting a little easier as we progress through this? I'm guessing that right now PPEs are probably a little bit easier to get. I mean, everywhere you go, there's more hand sanitizer than I've ever seen in my life.
Yes.
But
Yes, and sanitizing wipes and toilet paper is an abundant supply now, Dave, if you haven't noticed that, which is wonderful, obviously. It is getting it's getting a little more normal. I think we're kind of used to it. The supply issues have largely resolved for the most part. And I think the other really good thing that's happening is we're getting access to vaccine now. So, there's a lot of talk these days about the rollout, and I will just say in regards to that, coming up with a plan for delivering vaccine to a state is a really hard thing, and I think that we have to sort of appreciate the complexity and the urgency of this effort as we've tried to roll out the vaccine. It seems like things are really improving quickly, which is really great to see. We've got a lot of folks in our organization now who have received both doses of the vaccine. I was fortunate to get my second dose on Thursday. So within 24 hours, I think I will be considered fully vaccinated, Dave, which I'm pretty excited about. And I know a number of our colleagues have received the vaccine. So that's making it feel a little better. Obviously, there's some uncertainty about transmissibility of the virus, even if you are vaccinated. So we're going to be careful about that. But I think as time goes on, we're going to start to reintroduce more in-person programming. Some of our programs, like the Cancer House of Hope, for example, in West Springfield, has really, our program director, Margaret Toomey, has done an amazing job in transitioning some things virtual. But the reality is, for some people, when you're dealing with an acute cancer diagnosis, a phone call doesn't quite feel like enough. And, you sort of crave that in-person support, spending time with other people in the room and, sharing your experiences and getting those supports. So I think we're eager, when it's safe to do so, to start to reintroduce some more of those in-person services, because there's no question there are people who have dropped out of circulation because they're not able to do the in-person. And for them, and I understand this, the phone option doesn't always feel like it's what they need.
Are you finding that, though, with everything that you've had to do to deal with COVID-19, that when this does settle down, that yes, you've come to the realization that we can actually reach more people through telehealth and doing it different ways like that. So, I mean, I look at that and I think, well, that's probably one of the benefits that we've seen through this. And, there aren't a whole hell of a lot of them.
Yeah, well, through the fire, some good things come out, right? You get tested and you figure things out, and I appreciate that, because I think you're absolutely right. And the state has been quite progressive in terms of how it's reimbursing for telehealth services, and I know within our organization, talking to people, people feel like the model has been quite successful for most people. And I do expect that whether we're talking about a primary care visit or a mental health counseling session, you are going to absolutely see more embrace of the telehealth model, and that's a good thing. Now, one of the really important determinants of how we go forward in this is how effective are the services we're providing, right? And so that one, I think it's fair to say it's a little too soon to tell. Obviously, any intervention we perform, we want it to be effective. And so I think we need to do some homework and some research in seeing that, is a telehealth session equally as effective as an in-person session for someone who's coping with some mental health challenges? And I don't think we quite know that yet. I think some people, it's a perfectly fine solution. I know a lot of my interactions with my sort of doctor have been over the phone or video call. And for me, 46-year-old guy, that works fine. For others, it might not be the same. So I think we have to really, we're always obliged to examine the effectiveness of these things we're doing to make sure that people are in fact getting better. And I think that's one thing at CHD we're very focused on right now, is making sure that the data demonstrates that the work we're doing is effective work.
There's nothing like the personal touch, I guess, no matter what we do.
Yeah, I mean, I think that's right, and I think that's one of the ways we're certainly suffering in those in-person interactions. I mean, whether it's counseling or medical services or just anything. I mean, we didn't play basketball this winter, and my 8-year-old is bouncing off the walls. He's like a little ping pong ball when I see him, because he's not having that outlet for energy, and he misses it, and he misses seeing his buddies, and he cannot wait. It looks like we're going to have a little league season in the spring, and he cannot wait to get back out there. And I think you see in the kids, we were able to do some baseball in the summer and the fall, because of the nature of baseball, as you understand, it's a little more socially distanced, and we were very careful about that. But I have to tell you, the first time we got out there last July, the joy on the faces of those little guys and the joy on their moms and dads' faces, and seeing them doing something, quote, normal, was really, really priceless and great to see. And I think, we're experiencing that in so many facets of our lives, missing out on those kind of group social opportunities and the good feelings that come out of it. And we'll get back there. I think it's going to be a slow roll. And I know I'm sick of wearing a mask and getting out of my car and realizing I've left my mask in the car and turning around, and we're all tired of it. But I think we're going to continue to do it, because I think it'll keep more people safe, and obviously the most vulnerable folks will be safer that way. And hopefully the vaccines will really take hold, and we'll get back to playing basketball again and getting out on the golf course again and doing all that stuff.
Yeah, and when you talk about kids, I mean, we touched on this at the beginning too, that yes, as adults, and the stuff that we've seen, the stuff we've been through, whether it be 9/11 or just different things that have an impact on our lives, that yes, we're as adults, we're having a hard time dealing with this, and that's the thing that I can't fathom what's going through the mind of a 5-year-old child or a 9-year-old child, that how you process this. And as you mentioned too, that the fact is that this is not going to go away tomorrow for them. The long-term effects of this, I guess, it's something that none of us know what it will be.
And that's absolutely right. And I think as adults, and those of us who are parents and have children who are close to us in our lives, it is really important to take care of ourselves and do a check-in. I read recently 2 in 5 people in America are reporting significant mental health challenges associated with the pandemic. And frankly, I was surprised that it wasn't more. And one of the things that I think was an issue before COVID was this issue of being present with our kids and present with the people you care about, and these things, these cell phone things. And my tendency, frankly, to personalize this, to spend more time looking at my phone than I should when I'm around my kids. And all of our tendency, especially when big scary things are happening like a pandemic, to be hooked to Twitter and constantly seeing what the latest, what they call doom scrolling is showing us, and what scary thing is in the news today or this hour or next hour, whether it's, mutations of the virus or vaccines or anything else. And I think it sort of takes us away from the people we're in the presence with. And I've certainly tried to be very conscious of that, to disconnect from the phone, to put it down, to turn off the alerts. I mean, how many times do you get woken up by a news alert at 1 o'clock in the morning? And I think, boy, did I really need to know that at 1 o'clock in the morning and then spend an hour going back to sleep? I don't think so, not usually. And sleep is, I mentioned sleep, that's really important too. And I know so many of us have had those restless nights. I know I do, worrying about what's ahead and worrying about, how the long-term impacts are going to take hold on this. And so I think it's really important. I'm meandering a little bit, but I think it's really important for us as adults, especially adults who are caring for kids, to, ask yourself that question every day. Like, are you present? Are you here? And are you feeling okay? And if you're not feeling okay, figure out some ways to get some help in that. And that's perfectly okay.
That's good. And it makes me think about this is going into, we went into a very busy place here in Western Mass not all that long ago with our grandkids, and it was crowded.
Mhm.
And walking through there and thinking, well, how many people in here have COVID? And, and I guess in some aspects, that's a mental health issue. It's like, how are we going to get past that? That no matter where we are, whether it's a restaurant or a supermarket or a store where you're in a busy place and thinking, well, how many people have this or how that? It's just, and that's something you probably wouldn't think of as a mental health issue, but it is something, and
Yeah,
getting over that.
it's the undercurrent in so much of what I think the New York Times now has a little tracker thing you can put in your zip code, and it will tell you, will sort of make an attempt to answer that question you just asked, Dave, of, in any given public environment, how many of these 15, 20, 30 people are going to be actively infected. And you'd like to be able to say, well, it just becomes your normal and you get used to it. But it's just one of those other new anxieties that we all experience, and you hope it doesn't have too deleterious an impact on, the long-term sort of ability to socialize and get out there. I think the same thing. My wife wanted to take the kids to the mall yesterday, and she texted me, what do you think about taking them to the mall? And I said, well, I think it's probably okay. But those are conversations we're all having. And I think, one of the other sides of that equation, I went up a couple weekends ago to do a little shopping, and unfortunately, you see the impact in storefronts of some of this economic crisis taking hold, and you see businesses closing up shop, which is a terrible thing to see locally in Western Mass. And your heart goes out to the people who are affected by that, and you think, what is the right balance of being smart and being careful and reducing potential transmission of the virus, but also at the same time enabling people to maintain their livelihoods?
Yeah.
The restaurant business. I mean, you feel so sorry for people who work so hard trying to make a living and do good things. And those people are always the first people to sponsor your events or your little league or whatever. And how hard this has been on all of them. And I think, like so many things in life, I think it's really a question of finding the balance, whether it's sending kids back to school or going to the mall or going to a restaurant. It's finding the right balance of risk and responsibility. And I think, to make an analogy, there's a version of that happens every time you get on a commercial airliner, and there's a version of that happens every time you take your car on Route 91, right? Yeah. Risk and responsibility. And I think you just hope that as we all get more enlightened about, what the vaccine can do for us and the best ways to be safe, then most people will be making good decisions, and we'll all, get back together again before too much longer.
We can only hope. And you touched on this too, as far as businesses are concerned, and the fact that they would support the Center for Human Development and other agencies like that. That had to be a hit for you folks too. I mean, in this day and age, with these businesses who are barely surviving, they can't give as much as they used to, although many still are in many ways. What's the impact been on the center?
Yeah, so we've obviously, a number of our fundraising events that we typically hold to help sustain us have been affected by this. We were not able to do several things that we typically do to raise money for our programs, and that absolutely has been an impact. And the amounts of money that are coming in from a fundraising perspective are lower in some cases, which I completely 100% understand, given the challenges that our business partners are facing. I have to say, The community has really stepped up, whether it's the community foundation, other sort of very responsible members of the community, some of our business partners who perhaps have been less affected by the kind of day-to-day or the long-term impact of the pandemic have really stepped up and been incredibly generous. I do feel a sense of a community coming together. So in terms of understanding the importance of some of these services like the Cancer House of Hope, like Family Outreach of Amherst, Big Brothers Big Sisters of Hampshire County, certainly others have stepped up and we've done okay. We're going to have a golf tournament in the fall for the Cancer House. I hope you'll come out and play with us.
Absolutely.
We're going to have we had a great luminaria on the green in West Springfield in November, and we were able to do that safely outside. So we're going to keep some of these events going. I know Big Brothers Big Sisters has been able to do its Daffodil Run in sort of a virtual basis, but not a large group event, but individuals running on their own. And so that will continue. But it hasn't been too bad, but we're certainly feeling the impact. And we're just, we're grateful that so many have stepped up for us, even when it comes to things like PPE. DA Gallooni was here the other day with a delivery of thousands and thousands of masks that came from the New England Patriots Foundation. I'm always blown away by people who just take the time to reach out and say, hey, what can we do to help? And there's always things people can do. And if anyone wants to learn more about how they can help, chd.org is the website. And we're so appreciative. Not only for those who give, but for folks like you who are willing to help us raise awareness of the need.
Yeah, the spirit of giving is always there. And you're right. I mean, in some way, shape, or form, as tough as it may be, people do find a way to help out.
It's incredible. I once in a while, I'll open an envelope here and it will be a check from, someone, just an individual who wanted to help. And it may be a lot of money, it may not be a lot of money, but just to take the time and have the impulse to give and help folks who are dealing with challenges is, it's always the best part of my day when I open one of those.
As we look ahead, just for the growing need, and you touched on this as far as how people can get a hold of you. Before we get to that, though, let's talk about things that we may not have talked about. We've covered a lot of bases. Anything that we haven't talked about that you'd like to make sure the folks watching and listening know?
Well, we have. I have this. I have my notes sitting here in front of me, and I feel like we're just kind of flying all over all of it. I haven't really had to look at them, which is good because I was worried about rustling papers in the background. But I think one of the things I thought about in terms of the kids, and the kids issue is really an important one for me. And I think we know any family who has tried to access counseling resources knows it can be hard. And there are not enough resources in our local environment here. We need more child psychiatrists. We need more therapy options for kids. And that's something that CHD is working on, and we're serious about it. But one of the things I just wanted to suggest to people, and one of the things that has even worked for me in my own life, Mr. Rogers always said, we all know this famous phrase now around a difficult, scary event. Mr. Rogers said, always look for the helpers. And I think when we have opportunities to sort of enlist our kids as helpers and get them involved in the spirit of giving, whether it's, a small fundraiser or, a can collection, getting the kids feeling like they're doing something positive for people, writing letters to seniors who may be homebound is not only good for the community, but it's incredibly therapeutic for the kids to feel like they're not, victims of the pandemic, but rather they're responders to the pandemic. And I think, at an early age, when we can get kids feeling like they're doing something to help, they know about the doctors, they know about the nurses, we hope they know about the social workers, the police officers, the firefighters, the heroes who are out there every day doing this to help our community respond, the researchers, Lord knows. Letting the kids feel like they're getting on the team of responders and helpers and doing something to give back, in a way that's manageable for them. I think that's a really powerful thing. And I know it's something we've tried to do with our kids. And it seems like it's paying dividends. And so that was just kind of something I thought about. And again, exercise, I have to say, I can't stress this enough. I've really made a commitment to exercise in the last year and getting out. And it doesn't, you don't have to be running a marathon. Lord knows that would kill me, Dave, if I tried to run a marathon. That would have the opposite effect. But whether it's just getting out, doing the walk, doing some, exercise in your home in a safe way, obviously not being around people. If you can get to the gym safely, do that. But I think that to me is such a huge benefit for my own sense of mental health and wellness when you have the ability to do it, and you have the time and the sort of safe space to do it. That can really be a huge, huge positive influence on people mental health wise.
I think one of the other things we want to mention too is the fact that, listen, if you do need help, don't wait to get it because there's nothing wrong with asking for help. And that's why CHD is there.
Absolutely. Thank you. And the number is 1-844 CHD help. We have a really great portal on our website. You can request an appointment. You can do it all virtually. You can do it from your mobile device. We have, people ready to help whenever you feel like you want to reach out. And I 100% endorse what you said. Don't wait till you feel like you're in the crisis. It's okay to do a check-in on things. It's okay to suggest to a friend or a loved one that maybe they might want to get a little professional help. As I said earlier, I think the stigma is reduced, but it's still there. So whatever we can do to, keep these issues in the forefront and just make people feel like there are resources around, there are people who want to help you, who care about you, and who are, well positioned to do that in a professional way that will ideally get you in a better place. And, so many of us need it right now. And I just hope people will not hesitate to call if they do.
Well, it will help us sleep better at night knowing that the Center for Human Development is there. Ben Kraft, thank you.
Thanks, Dave. I really appreciate you having me on, and it's good to see you. And I'm going to hold you to your promise on the golf. Okay.
I'm in. My thanks to Ben Kraft for being my guest on this week's edition of the Even Better Western Mass podcast. Now, if you'd like to learn more about the Center for Human Development, visit their website, chd.org. Thanks for watching or listening to this week's edition of the Even Better Western Mass podcast. Stay safe, stay well, and if you can, join me next week.